everyone. Today we are at Barcelona and I am with the Dr. Professor Alkhayat from Egypt. He's my old friend, and this is actually the first time we met at this congress. And this is the opportunity to talk with him because he's actually the famous thoracic surgeon in Egypt.
Oh.
And he's worked in the Assault University as a professor. So, Dr. Okay, could you please give us some information about your hospital and your clinic?
Okay, thank you so much, my dear friend, for inviting me for this broadcast. And hello, everyone. It's my pleasure to be with you. About the thoracic surgery in my center, we usually in Egypt we are a cardiothoracic surgeons. We are not doing thoracic surgery or a pure thoracic surgery in our former training, but now with the increasing use of minimally invasive techniques, more surgeons are trying to be dedicated thoracic surgeon who do only thoracic surgery, other than doing some adult cardiac surgery, pediatric cardiac surgery, and thoracic surgery.
How many residents and how many fellows in Egypt right now?
Okay, as I mentioned, that we don't have an specific training program for only thoracic surgery. So what we have is cardiothoracic surgery, and as to our registry so far, we have more than 600 cardiothoracic surgeon consultants, and we have nearly the same or a little bit below number for the specialist and trainee. So, but for who's dedicated to be a thoracic, most of the time they decide this after they become a consultant. Maybe in the way of their specialty, they prefer to have more in-depth training in thoracic, but so far they have both. And even we have some, the new Egyptian board of thoracic surgery, it's dedicated for thoracic, but they have then to have 2 years of general surgery, 6 months of cardiac surgery, and the rest for thoracic surgery.
It's different from our country because in our country, after the medical exams, we are getting a thoracic surgery residency, and it takes 5 years. And actually, we have some rotation about cardiothoracic parts and general surgery parts. And mostly, we are work as thoracic surgery.
Nice.
So I know that you are popular in the portal What's in Egypt because you have a lot of workshops and it's really nice workshops. Actually, the ESTS also confirm your workshops, your
Yeah,
education.
it was endorsed.
So
Yes,
when
but-
you started What's surgery, because I think in your residency there's not too much cases about What's.
Okay, I start in your country.
Yeah, you also
I have
work as in Turkey.
yeah. In 2010, I met one pulmonology, a professor of pulmonology from Turkey, from Izmir, Dr. Simra, and she invited me to get a fellowship in thoracic surgery in Izmir, in Turkey. And in 2011, I moved to Turkey for 4 months. By this, I get the know-how of minimal invasive thoracic surgery, and then I go back to Egypt and start practicing. But after 1 year of practicing in Egypt, I confirmed that I can do minimal or minor VATS procedure, but not the lung resection, not the advanced ones. So I go back again to Turkey. This time was in Marmara University in Istanbul. I stayed there for 4 months, and I see the rectal surgery with Professor Yüksel, minimal invasive esophagectomies and lobectomies with Professor Patrial. A lot of people who touched me from Turkey, and then I returned back to Egypt. And then we started to practice, and we start our program by this. On the way, we have invite some of the professors to come. I have Dr. Shaida from Izmir coming to Asyut, and then I have Diego Gonzalez in 2016 in Asyut, and we formed the first uniportal VATS pneumonectomy in the country. And then subsequently, I have a lot of surgeons who come and help us moving the program forward. I think the point that you have to train a surgeon, then get the proper equipment that he was accustomed or trained with it, and then you have to like invite one of the experts for the first few cases, so he can give you a push, and you have to make the team, not only the surgeon, the anesthetist, the nurse, the worker, the physiotherapist, everyone should be on the go.
You want to say that the character is the important thing. Also, sharing the experience is the most important thing for our surgeries.
I think that
So-
when we are young, we can leave home and we can leave the country for like fellowship or something for a longer time.
Yeah,
But
it's
when
much
you
more
are
easy.
yeah, but when you are getting a little old, little, not
Yeah,
much.
not so much.
Yeah, you don't have much time and you have some financial and family ties.
Yeah.
So by this, you will need to have some like short visits, clinical immersion, 2 or 3 days conference, and some chats with old friends that can exchange ideas and get a more view about like diseases that you are not operating every day. Like we have a hydatid cyst in Egypt, but not very much. You have a lot of hydatid cysts. So
Yeah.
if I have a complication with one of patient with hydatid cyst, maybe I will ask you for that. So
Yeah.
we have a large number of like empyemas decortication. We do uniportal VATS decortication.
Yeah,
But
I
this is-
actually saw your publication in our actually the journal in the Uniportal Ampiema
Yeah.
surgeries. When I talked with you at that time, you said that our Ampiema surgery is really, really enormous numbers. So you are expert actually in the Ampiema decortication surgery with what?
That's because this is the most common operation done in my center.
Yeah.
So by
But when
this
you're
you,
going to Europe,
Mm.
you don't see any Ampiema surgery or
Mm.
decortication or hydatid cysts. These are going very low numbers.
Yeah.
So the numbers and experience changing to country to country. So this is the important. So this is why we are sharing our knowledge. And also, when we first opened the academy in Turkey, Thoracic Surgery Academy, the main purpose is sharing the knowledge. And also, I want to learn myself. How can I find the surgeons and how can I learn their techniques? So I needed some program, and I make this program to actually improve myself. Then I realized that everyone needs these types of things, so everyone share their knowledge
I
and
think
learn.
I think at specific time, the point is not that you know the information or to know how to do it, but to know who what you will be you ask for the knowledge. If you know which one you will contact to know more about this, will help you much. If you know this point, I think this will solve much more problems than expected.
And right now you perform the fourth suit workshop, right?
We
For-
did 10. We did 10
Yeah,
from
you did
2000.
10.
Yeah.
Oh.
We do 10, and expectedly, hopefully, we can do the 11th and next year on February. We are all invited to participate and to attend. We usually have 3 days, one live surgery. We use one case, not very complex, but just something that you can have some tips and tricks from. Then we have the scientific program with the emerging techniques, the new things that we can add on for our surgery and practice. And then the last day is having a hands-on experience, usually a wet lab, with some also not very complex operation, but something that you can have a small trick that can help you, like tracheal anastomosis, how just to take the trachea, how to make
This is also
tailoring.
important because if you select the complex cases, it's not for education. So it's like you
That's
perform
for
it,
the
yes,
ego.
It's for your ego. Yeah, you are the proctor. You perform it.
Yeah.
In the end, no one knows nothing. No one learns nothing.
Yeah.
So this is important. Sometimes when we perform the life surgeries, our professor said, let's perform the sleeve resection. And I said, why? Why we need to perform a coronary resection at life surgery? First, it's really dangerous.
For the patient, yeah,
Yeah.
exactly.
The second, no one learns nothing because
They can learn something, but the problem is that they see something that it is non-reproducible. Because if you have a one trainee that will they see like a coronal reconstruction by uniportal awake thoracoscope, okay, it's very nice. Can he do this at home? the answer is no.
Yeah.
So what is the value? What is the add-on value that he had? But if I show him that the case that he having it in everyday practice, but just I give him some tips and tricks or a new technique, other than do it multi-port, you can do it one port. You can do it on a spontaneous ventilated patients. You can learn how to do the block. So I think these points can improve, and you as a surgeon or a surgical trainee can learn it from a couple of hours or 2 days. But if I'm gonna teach you how to do a VATS lobectomy within 2 days, I should be a magician, not a surgeon.
Yeah, definitely. And what do you think about the future in Egypt? How about the surgery in Egypt? Because right now everything's changed. It's changed too fast. So one day we are trying to learning the uniportal watts, then the other day uniportal rods, AI, lots of things, 3D modeling is coming, all of them inside.
Yeah.
So what do you think in the future in Egypt?
I think the future is promising, not because not the current situation, but we have a population of 100 million, nearly like Turkey. So you have a demand, you have a community demand for the service, and you have an industrial push from the companies that wants to sell the new technology.
Yeah.
And then you have the problem with the economics, but eventually it will come. If you look through the starting of the VATS program, it was a very difficult to have the staplers, the cartridges, the energy sealing. So I think now it's more easy.
Yeah.
For the VATS. So, but it's still a problem for the robots. But again, they are keep going. So I think that it moves. It's not like here in Europe. It's much more faster. But I think it will eventually lead to, because you have a community demand, and even the community demand increase. People want to have their surgery and go home at the same day. They want to have a day surgery. They want to have ambulatory very fast.
Yeah.
So because they need to go to work and gain money. So I think this will push more to the minimally invasive keyhole surgeries, all the spectrum of ERAS, enhanced recovery.
And also, you're talking about the communities. How about the Egyptian society about the thoracic surgery? Do you have any society in Egyptian or any Africa society who are communicate with?
Yeah, we have plenty, because we have one Egyptian society for cardiothoracic surgery, and we have some societies that works with surgeons, like the Egyptian Scientific Assembly for Bronchology, that having a pulmonologist, pulmonologist and thoracic surgeons. And we have one society for thoracic interventions and lung transplantation, because they start a program for living donor transplant. And also we have a new upcoming African thoracic surgery society. So I think there is a plenty of scientific events, and still we need more.
I hope you will join our events too in the future.
Yeah, inshallah.
Inshallah. The Turkish Thoracic Society is right now getting bigger and bigger every day. Right now we have nearly 1,000 thoracic surgeons nice. In our society, and it's getting bigger, and lots of people join every day. So thank you.
Thank you so much. No, it's my pleasure to be with you.
Yeah.
Thank you so much.
And I hope you will enjoy our conversation. And this is the biggest opportunity for us, because I have a lot of chance to try to going to Egypt, but every time there's some problems, so it's canceled. So this is the biggest chance for us, because we are in the Barcelona ESTS Congress, and this is the first time we have
next year. Inshallah,
Inshallah,
we will have you.
yeah, sure.
Thank you.
See you. Okay, see you our next episodes, and thank you. Bye.